about digestive system. Система пищевода. And first part is oral cavity, cavitas oris. Oral cavity consists of two parts. First is vestibulum oris and cavitas oris propria, proper oral cavity. Vestibulum oris limited by lips and cheeks outside and teeth and gingivas inside. What is lip? Lip is musculus orbicularis oris, covered with skin outside, mucosa inside. What is cheek? Cheek is musculus buccinator, covered with skin outside, mucosa inside. Lips, upper and lower unit together with adhesion laterally. And in middle position there is frenulum, labia superioris et inferioris. Next. Next is cavitas oris. Border. So, in front, teeth, behind opening leads to the pharynx. This opening named fauces, in Latin fauces. Fauces bordered. Above is soft palate, below is root of tongue, and laterally is arch. Arch between soft palate and tongue. Arch name arcus palatoglossus. To the pharynx another arch, arcus palatopharyngeus. Inside arch there is muscles. A little bit later about it. So arch, how it looks. This is above soft palate, below root of tongue, and this is arch from soft palate to the tongue. Девочки, не надо громко. Behind opening. So, above is palate. What is palate? Palate consists of two parts. Bony palate or hard palate, in Latin palatum osseum. Palatum osseum formed by two parts of bone. Processus palatinus of maxillae and lamina horizontalis of palatine bone, and covered with mucosa. This is anterior to third. And soft palate. What is soft palate? Soft palate, this is duplication of mucosa with muscles and aponeurosis inside. So this is muscles with connective tissue covered with mucosa. Last part of soft palate hangs freely and form velum palatinum, like certain on the window. And in the middle, last part of velum palatini is uvula. In soft palate we have 5 muscles. In the arch, arcus palatoglossus, inside muscle musculus palatoglossus, to the pharynx, arcus palatopharyngeus, inside musculus palatopharyngeus, and 3 more muscles, musculus tensor veli palatini, musculus levator veli palatini, and in the uvula, musculus uvula. So this is above. What is below? Below is bottom of oral cavity, diaphragma oris. Diaphragma oris formed by musculus miliohyoidus and musculus geniohyoidus. What is content of oral cavity? Content is tongue. What about tongue? Bless you. Tongue, in Latin, lingua. Greek name, glossa. Consists of body, corpus linguae, root, radix linguae. This is tip, apex linguae. This is border, margo linguae. Facies inferior linguae. And this surface is like back, dorsum linguae. Between dorsum linguae and root of tongue there is groove, sulcus terminalis. In the center of this groove, this is blind opening, foramen cecum. Tongue is organ, sensory organ. Dorsum of tongue covered with papillae. We have a lot of a different kind of papillae. So all dorsum covered with papillae filiformis and papillae conici. These are for usual sensitivity, tactile, pain, temperature sensitivity. Closer to the tip, here, there is papillae fungiformis. like mushroom. Fungiformis for salt and sweety sensority. On the border, papille foliate. Foliate for sour sensitivity. Close to the terminal groove, the biggest, is papille volate. These are for bitter sensitivity. Inside tongue we have muscles. There are two groups of muscles. Skeletal muscles to change position of tongue and its own muscles to change shape of tongue. Skeletal muscles start from name musculus styloglossus, musculus palato, genioglossus, and musculus hyoglossus. From styloid process, from hyoid bone, and from mandible. Change position of tongue. And most muscles inside tongue. There is musculus longitudinalis superior, longitudinalis inferior, musculus verticalis, and musculus transversus. This muscle change shape of tongue. Tooth. So, we have permanent and milk tooth. Tooth in Latin dens, plural dentens. So, we have formula for permanent tooth, 2, 1, 2, 3. And we have formula for milk tooth, 2, 1, 0, 2. What does it mean? We have incisors, dentens incisivus. We have canines, dentens canins. We have dentens premolaris and dentens molaris. Structure of tooth. Tooth is dentinum. Inside is cavity, pulp cavity, cavitas pulpis, cavitas dentis. This part is apex. Part inside bone is root, radix dentis. Part above is crown, corona dentis. Between is neck. Crown covered with enamelum. Root covered with cementum. Between tooth and bone there is connective tissue, periodontum. Because of connective tissue, this is syndesmosis named gomphosis. Okay. Good. Next is salivary glands. We have a lot of salivary glands. 3 is bigger and a lot of small. Bigger. First is parotid gland, glandula parotida. It placed in fossa retromandibularis, behind mandible. So, what is fossa? In front is branch of mandible. Behind is processus mastoidus and musculus sternocleidomastoidus. Above is meatus acousticus externus, and medially, bottom is fossa, is 3 muscles. 3 muscles, sometimes named like anatomical buffet, Riolan's buffet. 3 muscles, all from styloid process. Stylo hyoidus, stylo glossus, stylo pharyngeus. So, this is parotid gland, glandula parotida. Glandula parotida is alveolar gland. And it has duct. Duct goes ductus parotidus, another name is Stenon's duct. Goes to the vestibulum oris and opens along the second molar in the vestibulum oris, upper to maxilla. Next gland is glandula submandibularis. It placed in the fossa submandibularis below bottom of oris. This tubular alveolar gland and has duct, ductus submandibularis. Another name is Wharton's duct. It opens, so below tongue we have fold in oral cavity. Fold below tongue, sublingualis. Fold plica, plica sublingualis. In the end of the fold we have caruncula. Here is opening for ductus submandibularis. And below tongue, inside oral cavity, so above bottom of oral cavity, we have glandula sublingualis. Glandula sublingualis has a lot of ducts. Opens in plica sublingualis. But biggest opens with submandibular duct in the caruncula in plica sublingualis. And this is Bartholin's duct. Produce saliva. And last part Last is pharynx. So, this is nasal cavity. This is oral cavity. Behind nasal and oral cavity is pharynx. Pharynx. Pharynx is funnel-shaped organ, muscle organ. And now we start learning about what is syncope. Syncope is projection of organs to the skeleton. So, pharynx start from base of skull till 6 cervical vertebrae. At the base of skull, pharynx attached to the base. And pharynx attached not only one place, it's like line of attachment. Line of attachment of pharynx. So we have tuberculum pharyngeum on the occipital bone. Next, between temporal and occipital we have fissura petro-occipitalis. Then pyramid of temporal bone, apex of pyramid. Then between temporal and sphenoid bone we have fissura petro-sphenoidalis. Then pterygoid process along plate, medial plate. Lamina medialis, processus pterygoideus, osis sphenoidalis. And then linea mylohyoidea. This is maxilla and linea mylohyoidea on the mandible. Okay? So this is line of attachment of pharynx to the base of skull. Pharynx consists of 3 parts. Parts behind nasal cavity is pars nasalis, nasopharynx. Pars behind oral cavity is oropharynx. And pars behind larynx is laryngopharynx. Pars laryngis pharynx. So, and syncope. Pars nasalis from base of skull till upper border of third cervical vertebra. Oral part at the body of third cervical vertebra, and pars laryngis from lower edge of third cervical vertebra till 6th cervical vertebra. What about structures? So, syncope now. I'm sorry, that was skeletotopy, projection of the skeleton, and now syncope. What is position of organ related to other organs. So, in front of pharynx we have nasal cavity, oral cavity, and larynx. Behind the pharynx we have vertebral column. Don't forget about space, retropharyngeal space between 4th and 5th fascia of neck. And what is laterally? Laterally from pharynx we have neurovascular bundle of neck. Now, internal structure. It means walls. Pharynx has walls, and only pharynx has 4 layers in the wall. First layer is the tunica mucosa, vitella submucosa. Next is fascia, fascia pharyngobasilaris. This fascia attached to the base of skull. Next is muscle tunic. Muscle tunic has 2 groups of muscles. First is longitudinal. So, one is musculus palatopharyngeus in the arch, arcus palatopharyngeus. And second from styloid process, musculus stylopharyngeus. These are longitudinal. And next is circular. Circular is around pharynx. And there are 3 constrictors. Constrictor superior, medial, inferior. And last layer is again fascia. Second fascia named fascia buccopharyngea. This fascia starts from musculus buccinator. You remember only buccinator muscle has fascia. So, because of need fascia for pharynx. Fascia number 4 for pharynx. What structure of inside? So this is nasopharynx. In front of nasopharynx, connection with nasal cavity. This is choane. Inside nasopharynx, we have opening. This is exit from auditory tube, from temporal bone. Ostium pharyngeum tube auditiva. Above and behind, it form like this part is torus tubarius. How do you English? Valley. So, this part named torus tubarius. This is cartilage part, last part of auditory tube. Between ostium and soft palate, here is tonsil. What is tonsil? Tonsil, this is accumulation of lymph tissue. And here is tonsillia tubaria. Between upper and posterior wall of pharynx in the middle position, this is tonsillia pharyngea. Pharyngea unpaired. Pharyngia tubaria paired. Another place for tonsils. Between two arches, arcus palata glossus and arcus palata pharyngeus, we have it. Fossa tonsillaris. There is one more tonsillis, again paired. Tonsillia palatina. And in thickness of tongue, we have one more tonsillia, tonsillia lingualis. Now we have 6 tonsils. And these all tonsils form ring. Lymph epithelial ring of Pirogov-Valder. This is protection. Next, oropharynx. Connection with oral cavity is phoesis. Last part is laryngopharynx. Laryngopharynx is here and has one connection with larynx. In Latin, in English, laryngeal inlet. In Latin, additus laryngis, enter to the larynx. Then pharynx continue to the esophagus. So, yes. Okay. Esophagus, hollow tube-shaped muscle organ between pharynx and stomach. Esophagus is placed in the neck, thoracic cavity and abdominal cavity, last part. So it has 3 parts. Neck part, skeletopy from 6th cervical vertebrae till 11th thoracic vertebrae. Neck part from 6th cervical till 2nd thoracic. Synthopy. In front is trachea, behind is vertebral column, laterally neurovascular bundle. Now you should know what is it. This is arteria carotis communis and recurrent laryngeal nerve. Next part is thoracic part, but thoracic part is very long and we divide it on 3 parts. Upper third, from 2nd cervical vertebra. Upper third, synthopy. In front. Do you remember? In front we have trachea. In thoracic part, trachea go to the right side. So trachea to the right. In front, after arch, aortic arch, we have left common carotid artery and left recurrent nerve, laryngeus recurrent nerve. What is on the right? On the right we have ductus thoracicus. This is big lymph vessel. Behind still vertebral column. Second third of esophagus. So, thoracic duct was on the left side. Now on the second third it's behind, because thoracic duct goes from behind to the left side. Also behind we have, no, not behind. In front we have aortic arch at the level of 4 thoracic vertebrae and bifurcation of trachea at the level of 5th thoracic vertebra. From left we have subclavian artery, vagus nerve left, and on the left also we have descending aorta, arch descending aorta. From right side we have vagus nerve and azygos vein. And lower third. In front we have pericard, so heart with shells. Behind we have descending aorta from left goes behind with thoracic duct. And from left and right we have 2 vagus nerve, left and right. And also on the right we have azygos vein, azygos only on the right side. And also vagus nerve left goes in front and right goes behind in the lower part. Abdominal part from 10 to the 11 thoracic vertebra, placed in abdominal cavity. Above is diaphragm, below stomach. To the right and in front is liver. From left side we have spleen. Special about abdominal part, because So configuration of stomach in my body is like here, yes? So this is last part of esophagus. And what about last part of esophagus? In front and by the sides, it covered by tunica serosa in abdominal cavity. Behind, still adventitia. Because of this, 3 walls covered by tunica serosa, this is organ of mesoperitoneal position. 3 walls. But you should understand, it named organ of mesoperitoneal position, but only for abdominal part. Another parts is only tunica adventitia, tunica serosa in abdominal cavity. Okay? So, last part of esophagus. Now, structure of wall. Inside tunica mucosa. Tunica mucosa with longitudinal folds for passage of food. Next layer is muscle tunic, tunica muscularis. Tunica muscularis has inner circular and outer longitudinal layer. This is usual structure. And outside is tunica adventitia, except abdominal part with tunica serosa. Okay? So, esophagus, 3 layers of wall. Yes? This is usual structure. Only pharynx, 4 layers. Okay? Okay. Esophagus. And narrowings of esophagus. Narrowings. Yes?
Yes.
We have 5 narrowings, 3 anatomical. When pharynx go to the esophagus at the level of 6 cervical vertebrae. Next, when bifurcation of trachea. And last is when esophagus pierced diaphragm. And 2 functional, when aorta close to the esophagus and when esophagus goes to the stomach. So this is also narrowing. Now stomach. What about stomach? So, stomach in my body placed like here. It can be like hook or more horizontally. So, placed stomach here. And we have anterior wall of stomach, posterior wall of stomach. By the way, stomach in Latin, ventriculus. And the second Greek name is gaster. This is hollow muscle organ placed in abdominal cavity between esophagus and duodenum. Stomach has skeletopy. Skeletopy belong to the enter and exit. Enter, this part is cardiac, so this is cardiac opening. And this is part pyloric, so this is ostium pyloricum, pyloric opening. Cardiac opening is behind the left 7 cartilage of left 7 rib at the level of 10 thoracic vertebrae. Exit at the level of 11 thoracic vertebrae behind the right cartilage of right 8 rib. So from left to the right. Parts of stomach. This part is cardiac part. Then we have body. This is fundus. How to border. So this is notch. Notch close to the cardiac part. Incisura cardiaca. From incisura cardiaca line, this is fundus. This is cardiac part. Then we have, this is lesser curvature. This is greater curvature. Curvatura ventriculi minor, curvatura ventriculi major. This is angle of ventricle, angulus ventriculi, and this is notch incisura angularis. If we separate this line, so this is fundus, all of this, body, corpus ventriculi, fundus ventriculi, and last part is pyloric, pylorus, pars pyloricus. Pyloric consists of antrum, and last part is canal. Canal ended with opening. Inside opening we have fold, inside fold we have sphincter, sphincter pylorici. This sphincter works very well. This sphincter works not very well. So we can have reflux or regurgitation. Now, what is inside? Internal structure. Inside is tunica mucosa. Tunica mucosa with a lot of folds. Fold direction is oblique, except along the lesser curvature we have longitudinal folds. Because of, for lesser curvature we have quick passage. We should have quick passage. So longitudinal folds for quick passage, fluid parts of food, liquid parts of food. After tunica mucosa, we have tunica muscularis. In the stomach, we have three sublayers of muscle tunic. We have outer longitudinal, inner middle circular, and inner oblique fibers. What is outside? Outside, all ventricle covered by tunica serosa. Tunica serosa, part of peritoneum. So, because of this, ventricle is organ of intraperitoneal position, inside peritoneum, covered by peritoneum. In folds, we have cells, glands with cells. We have glands of cardiac part, fundus and body, and pyloric part. So three kinds of glands. And there are difference what produced. Cells produced pepsinogen and mucose in cardiac part. In fundus and body produced pepsinogen, mucose, and hydrochloric acid. Hydrochloric acid. And in pyloric part, produced only pepsinogen. And function of stomach. There are 5 functions of stomach. First, because of muscle organ, motor function can move. Second, it produced gastric juice, so pepsinogen, mucose, and hydrochloric acid. And also it produced inner factor of Castle for vitamin B12. So this is secretory. Then suction function. It can absorb water, alcohol, and some medicine. Then protective function. Because of acid, it kills microorganisms. And last is digestive function. Because of for protein produced pepsinogen for proteins produced. Digestive function. So what is next? Then we have intestine. We have small and large intestine. Small intestine is duodenum, then jejunum, this part, and ileum, this part. These are small intestine. Small intestine in Latin intestinum tenue. Greek name enteron. Because of this inflammation of all intestine, small intestine is enteritis. Duodenum doesn't have mesentery. Jejunum and ileum have mesentery. Because of this, jejunum and ileum named like mesenteric part of small intestine. So, start with the duodenum. Duodenum is hollow muscle organ, part of small intestine. After stomach leads to the jejunum. It consists of upper part, pars superior, then turn, flexura duodeni superior, descending part, pars descendens, again turn, flexura duodeni inferior, horizontal part, pars horizontalis, and little ascending part. It lies on at the level of first lumbar vertebrae, then descending part till third lumbar vertebrae. Horizontal part and ascending part goes till second or first lumbar vertebrae again. In the end, it makes turn leads to the jejunum. This turn is flexura duodena jejunales. From this flexure, we have ligaments attached to the vertebral column, ligament of Treitz. What is structure of duodenum? At first, duodenum syntype. It lies around head of pancreas. So pancreas like inside and from left. What is outside? Flexura attached to the liver, close to the gallbladder, and also close to the right kidney. Above is stomach, below is intestine. What is position of duodenum? Upper part, another name is bulb of duodeni, is intraperitoneal position, like stomach. But then duodenum, it's not correct, this heading. Correct is this part behind. So superior part goes back and goes out of peritoneum. So descending, horizontal, and ascending part is extraperitoneal position. Extraperitoneal position means only anterior wall touched to the peritoneum. Okay? So another wall covered with tunica adventitia. In some source, you will find that there would be one more position, retroperitoneal, if no any wall touched to the tunica serosa. What is look like the same, touch or not touch, with just close. So internal structure of duodenum. How to show the stomach. And after stomach we have duodenum. Duodenum usually around pancreas, so this is part of pancreas. So placed pancreas here and around is duodenum. So superior part, descending part, horizontal part, and little ascending part. What is inside? Inside tunica mucosa. Tunica mucosa has a lot of circular folds. Only one longitudinal folds here, close to the pancreas. Because of on this longitudinal fold we have Vater's papilla. This is papilla duodeni major. Inside papilla we have ampulla. Ampulla, this is unit of pancreatic duct and bile duct. But pancreas sometimes has additional duct, and this duct opens in papilla duodeni minor, proximally from major. So only one longitudinal folds. Next, after tunica mucosa we have tunica muscularis. In tunica muscularis we have inner circular and outer longitudinal layer, like usual. And what is outside? Outside is tunica adventitia except superior part. Superior part, intraperitoneal position, so outer layer is tunica serosa. What is after duodenum? After duodenum, yes, we have jejunum and ileum. You will find it like this. And what is this? So, from posterior abdominal wall, peritoneum goes to the organ, goes around it, and goes back to the posterior abdominal wall. So it covers organ. So this is duplication of peritoneum. So this duplication hold the organ attached to the posterior abdominal wall. And this duplication named mesentery of organ. So this is small intestine, Greek name mesenteron. So mesentery for mesenteron, mesentery. Sorry, enteron, mesenteron. Duplication of peritoneum for enteron, mesenteron. So this is mesenteron, and this is jejunum or ileum, and there are no strict border between jejunum and ileum. What is structure? Structure like usual, inside tunica mucosa with a lot of circular folds. In tunica mucosa we have villi intestinalis for suction, and also lymph nodes. We have solitary along lymph nodes or grouped papers, patches. Grouped nodi lymphatici aggregati, and nodi lymphatici aggregati only in ileum. So, what are differences of small intestine? Circular folds, nodi lymphatici aggregati, and villi intestinalis, only in small intestine. How to show last part of small intestine, ileum? You should find first part of large intestine. So, this is large intestine, and this is last part of small intestine. So this is definitely ileum, last part. Before end of ileum, along 1 meter, there are one more little part like appendix, named diverticulum of Merkel. Now, large intestine. What is large intestine? Large intestine, intestinum crassum. Another name, colon. So inflammation of colon, colitis. First part is cecum. Another name of cecum is typhlis. Inflammation of only cecum, typhlitis. Then ascending colon, transverse colon, descending colon, then sigmoid colon. Sigmoid colon has second Greek name is Romana. Inflammation of sigmoid colon, Romanitis. And last part is rectum. Rectum has second Greek name is Proctus. Inflammation is Proctitis. So first part is cecum. Between ileum and cecum we have angle, angulus ileocecalis. Inside cecum we have two fold with sphincter that form valve, valva ileocecalis, or Bowkin's valve. From cecum we have appendix vermiformis. Appendix vermiformis. This is part of lymph system. Cecum covered with peritoneum, so it covered with tunica serosa, but doesn't have mesentery. Appendix covered with tunica serosa, so again organ intraperitoneal position, and has mesentery. Mesentery for appendix, mesappendix. Then ascending colon touched to the posterior abdominal wall, so covered with tunica serosa, only 3 walls, so organ of mesoperitoneal position. Then transverse colon covered all walls, so intraperitoneal position, and has mesentery, mesocolon transversum. Then descending like ascending, touch posterior abdominal wall, so mesoperitoneal position, only 3 wall covered by tunica serosa. Then sigmoid colon covered all walls, so intraperitoneal position and have mesentery, mesocolon sigmoidum. So, rectum later. Now, what is the structure of large intestine? Now, large intestine. So, from inside there are no circular folds, there are half folds, semi-lunar folds, half moon. And this is tunica mucosa. After tunica mucosa we have tunica muscularis. Tunica muscularis has inner circular and outer longitudinal. Both longitudinal form bands, no circular, like only longitudinal, only in bands. There are 3 bands. Do you see this structure? These bands, only 3 bands. So this is longitudinal layer of muscle tunica. And because of contracts, it forms pocket from large intestine. This pocket named haustre or gaustre. Haustre coli, tenia coli, gaustre coli. And also covered by tunica serosa, and tunica serosa has this structure. This is tunica serosa pockets with fat tissue inside, named appendices, omentales or epiploides. You can say both. Appendices omentales, appendices epiploides. So, what are differences of large intestine? Tenia coli, gaustre coli, appendices omentales. 3 differences of large intestine. Now, what about rectum? Rectum has a hollow muscle organ after sigmoid colon goes outside with external environment. Last part of rectum is anus. Rectum placed from promontorium and lies on the sacrum. Sacrum is convex, so it has turn on the sacrum, pelvic part, and it placed in pelvic cavity. So flexura pelvic and flexura perinealis. So in pelvic part pass through the perineum and flexura perinealis. 2 turn and 2 parts. Upper part is extended. This is ampulla recti. In ampulla recti we have fold. This is like last transverse fold, like semilunar. 3 or 4 transverse fold. In second part not extended and looks like canal. And because of anus, its name is canalis analis, anal canal. Inside anal canal we have longitudinal folds, and these longitudinal folds are permanent. We cannot disappear it. Because of permanent, it looks like column, so it names columnae analis. And between columna analis we have pocket named sinuses, sinus analis. There are glands produced mucose. And position of rectum. Upper third covered with tunica serosa, so this is intraperitoneal position. Second part, not covered, full, so this is mesoperitoneal position. And last part, only tunica adventitia, extraperitoneal position. That's all. So, what will be next? So, this topic is liver. Liver in Latin, hepa or gepa. Liver placed in abdominal cavity. Position of liver is mesoperitoneal position. So, some parts of liver not covered with tunica serosa. But not only tunica serosa covers liver. So, tunica serosa, but between liver and the tunica serosa we also have connective tissue, form capsule, fibrous capsule. Capsula fibrosa has its own name, Gleason's capsule. And pain gives not liver, pain gives Gleason's capsule if damaged liver. There are a lot of nervous ending in Gleason's capsule. So, liver has right lobe and left lobe. At first, scale of the P. Closer to me. So, we have lines. First line is sternum. Close to the sternum, linea sternalis. Now, clavicle. In the middle of clavicle, linea medioclavicularis. Between medioclavicularis and sternalis, we have parasternalis. Then we have axillary cavity. Anterior border of axillary cavity, linea axillaris anterior. Posterior, linea axillaris posterior. In the middle, linea axillaris media. On the back, linea spinalis, spinous process. Then, close to the vertebra, linea vertebralis, and lower end of scapula, linea scapularis. Lower angle of scapula, linea scapularis. Okay? So, this line of the body. Now, scale the view of liver. At first, so how to understand where is point? So, we have lines and we have ribs or space between ribs. First point is 10 intercostal space at the linea axillaris media. Then goes to the 4 intercostal space, linea medioclavicularis. Then goes to the left side, above xiphoid process, to the 5th intercostal space, linea parasternalis. So we have 3 points, and this is triangle of liver. So now holotopy of liver. Most part is regio hypochondriaca dextra and regio epigastrica. Now synthopy. So we have this border is sharp and this border is obtuse. Sharp border looks in front and down, obtuse behind and up. This surface covered with diaphragm, facies diaphragmatica. Lower surface close to the organs. Organ in Latin viscera, plural viscerae. So facies visceralis. Now synthopy, above and behind diaphragm. Here to the right abdominal wall. Below, so organs close to the liver form impression. So here is stomach, a little behind is esophagus. Then we have gallbladder. Above gallbladder we have duodenum. Here we have flexura coli dextra and coliac impression. Here we have kidney, impressio urinalis, and here impressio adrenal gland, suprarenalis. Okay, so this is synthopy of liver. Now, external structure. So, right lobe and left lobe. And liver has ligaments. These above and between lobes we have ligamentum falciforme. Behind this ligamentum cardiacum. Tunica serosa, and here is diaphragm. Here we have triangle and here we have triangle. Ligamentum triangulare sinistra, triangulare dextra. Below, continuation of falciform here. This is round ligament of liver, ligamentum teres hepatis. In this ligament form notch, incisura ligamenti teritis, and ligament continuation to the slit. Usually here is slit. Fissura ligamenti teritis. Slit goes to the posterior surface, and this slit for another ligament, ligamentum fissura ligamenti venosi. Here is venous ligament. In venous ligament we have ligamentum venosum. We have duct of Arantes. In round ligament we have umbilical vein. So we have slit here, and we have two structures here. This is gallbladder. It lies in the fossa. Gallbladder in Latin vesica fellia, fossa vesica fellia. Here we have vein, vena cava inferior, and this is groove for this vein, because we have only inferior and abdominal cavity. Groove named just sulcus vena cava, without inferior. So we have structure here and structure here, and in transverse heading we have this structure like gate in liver, porta hepatis. In porta hepatis we have triad of liver. What is triad of liver? So this is vena cava inferior, and this is also vein, vena porta. Next, this is artery, arteria hepatica propria. And here, this is ductus halederus that forms by unit of ductus cysticus after vesica fellia and duct after liver, ductus hepaticus communis. So triad of liver is vena porta, arteria hepatica propria, ductus hepaticus communis. This is triad of liver. Ligaments, surfaces. Now, there are no cavity inside liver, so this is not hollow, this is parenchymal organ. And about surfaces, where is ligament, where is gallbladder, and partially posterior surface not covered with tunica serosa. Because of this is organ of mesoperitoneal position. Function of liver. So liver has 5 functions. At first, it production bile. All the time, without pause, without breaks. If we don't need bile, bile accumulate in gallbladder. Next, liver take part in all kind of metabolism. Then, because of vena porta, or you can say vena porta hepatis, collect blood from intestine, liver also has a protective function because of metabolism of protein from intestine. Then liver is depot of iron, vitamins and glucagon. And last is in embryo, liver produce blood. So hematopoiesis in embryo. 5 function of liver. Next. Next is gallbladder. Gallbladder in Latin vesica fellia. It lies in the fossa vesica fellia on the lower surface of liver, on visceral surface. Bladder is hollow organ. So external structure. This is fundus, then body, and very close to the duct is neck. There are no strict border between these parts. After neck, this duct is ductus cysticus, because of cystus, another name. Cystic duct unit with common hepatic duct and form bile duct, ductus halederus. What about internal structure? Inside tunica mucosa, then tunica muscularis, and outside is tunica serosa. Usually this is organ of mesoperitoneal position, so partially covered with tunica serosa. Only fundus covered at all, body covered with 3 sides. But is it normal if gallbladder has tunica serosa around all gallbladder? So sometimes it can be intraperitoneal position, even has mesentery for gallbladder. But usually mesoperitoneal position. When gallbladder is full, it farther from the liver and covered a little more with tunica serosa. Next is function. Function of gallbladder is only one function, accumulation of bile. Next is pancreas. What about pancreas? So this is stomach. In my body, stomach set like this. So it's a ball, go to the right side, then on the right side we have duodenum. Duodenum around pancreas. So first part of duodenum, descending, horizontal and ascending. So this is pancreas. Pancreas a little rise. From second to the first, sometimes 12 thoracic vertebrae. Where is pancreas? Pancreas is inside abdominal cavity, but not inside peritoneal cavity. Between peritoneal cavity, it's in front, and behind is posterior wall of abdominal cavity. So this is retroperitoneal space. So pancreas is extraperitoneal position, not covered with tunica serosa. And this is very dangerous because there is nothing that covers pancreas. Pancreas doesn't have no tunica adventitia, no tunica serosa, no tunica albuginea, no any fibrous capsule. So inflammation of pancreas immediately goes to the fat tissue around it. And because pancreas produce ferment, inflammation of pancreas release ferments and pancreas eat itself. So if acute pancreatitis, need the operation with cut pancreas, whole or partially. It's very dangerous. Now, external structure of pancreas. This is head, caput pancreatis. Then body, corpus pancreatis. Last part is tail, cauda pancreatis. On the head, little part named processus uncinnatus. Between head and body, here is notch, incisura pancreatis. Pancreas is again not hollow organ, there are no cavity inside, so there are no internal structure, parenchymal organ. But inside there is duct, ductus pancreaticus. Another name, Wirsung's duct. Where does it go? Wirsung duct from tail, whole body, and goes to the duodenum. In last part, Wirsung duct, you need with Holedach, ductus holedicus, and form extension, ampulla pancreatica duodenalis. After ampulla, it goes to the papilla, fatus papilla. But also in pancreas, sometimes we have accessory additional duct that opens in minor papilla, duodenum. So this is accessory, this is main. Now, function of pancreas, syncope. What organs around pancreas? So, duodenum around, in front, stomach, behind two big vessels, descending aorta and vena cava inferior. And here is spleen. Now, function of pancreas. Pancreas has double secretion, extra secretory function and intra secretory function. Extra means out from body, intra inside, all the time inside blood. So outside produce secrete pancreatic juice inside duodenum. Amylase, trypsin and lipase. For these are ferments. What produce inside? Inside pancreas in the body and tail, we have islands of Langerhans that produce 6 hormones. So they produce insulin, glucagon, pancreatic polypeptide, somatostatin, ghrelin, gastrin. 6 hormones. And something more. Sphincters, yes. So, bile system has sphincters. So, let's see. This is gallbladder. After gallbladder, we have first sphincter, sphincter of Lütgens. Then, when you need ductus cysticus and ductus hepaticus communis, you need and form ductus holedicus. Here is Meritz sphincter. And ductus holedicus you need with Wirsung's duct and goes to the ampulla pancreatic duodenalis. And last sphincter is sphincter of Oddi. So you should know only 3 sphincters. Now that's all. This is spleen, in Latin lean or spleen, double name. So, spleen is placed in abdominal cavity, inside peritoneal cavity. So this is organ of intraperitoneal position. It's unpaired parenchymal organ. This is central organ of immune system, main function. So for my body is placed like this. So not correct, not this, with the angle. So what covers spleen? Like liver. At first fibrous tunic, then serose, except little one place. But this little place for vessels. So still organ of intraperitoneal position. Sclerotopy. What about sclerotopy? So, linea axillaris media from 9 till 11 rib, and this size from linea axillaris anterior along 10 rib to the linea axillaris posterior. Make cross with spleen. Next, syntopy. Above is diaphragm. Below is kidney with adrenal gland and close flexura coli sinistra. From right of spleen is stomach. Behind and below is tail of pancreas. Golotopy. Regio hypochondriaca sinistra. So spleen is organ of intraperitoneal position. At first, spleen covers with tunica fibrosa like liver, then tunica serosa. And tunica serosa not covers spleen only in one place, here. And this place named like gate, but not porta. Porta linis, its old name. Now it's hilum linis. So external structure. Spleen has, like liver, diaphragmatical surface and visceral surface. And also it has extremitas anterior, extremitas posterior, margo superior, margo inferior. Now it's parenchymal organ, so it's no cavity inside. And function. Yes. Function, three function for spleen. This is organ of immune system, so main function is differentiates of lymphocytes. Also, this is depot of erythrocyte and graveyard of erythrocyte. How much time lives erythrocyte?
120 days.
120 days.
Repeats.
Lifespan is
120 days.
120 days.
4 months.
Okay, it's spleen. Yes. Next is peritoneum. What is peritoneum? First on the chart, then on the body. Peritoneum is serosa, so it's tunica serosa. Tunica serosa placed in abdominal cavity. Abdominal cavity bordered with wall, anterior, lateral, and behind this vertebral column. And inside it, we have tunica serosa that covers organ and walls. So, tunica serosa has parietal sheet, blue color, and visceral sheet, red color. When tunica serosa goes to the visceral sheet, it forms some structures, like ligaments. Yes? Do you remember? Falciform ligament or cardinal ligament. This is derivatives of serosa. Now, we have abdominal cavity and inside tunica serosa. Inside tunica serosa, between parietal and visceral sheet, we have space. This is peritoneal space between two sheets of peritoneum. But itself, peritoneum, placed inside abdominal cavity. Okay, so abdominal cavity is bigger than peritoneal cavity because abdominal cavity is peritoneal cavity with retroperitoneal space. Okay, in retroperitoneal space we have organs and fat tissues. Now, we divided what is inside peritoneal cavity. There is serous fluid for peritoneum about 20 milliliters to reduce friction. Now, how we divide it? We divide it on 3 floors, peritoneal cavity. First floor border is mesentery of transverse colon. This is first floor, upper. Then we have middle floor, till small pelvis, till pelvis. And pelvis corresponds to the lower floor. And we have in floor different structures. Most important is this floor. This floor is upper, and inside upper floor we have 3 bugs. Bugs in Latin, bursa. Let's go to the body. So, this is diaphragm, this is liver. So, this is intestine, and here is border between upper and middle floor. So, this is upper floor. In upper floor we have 3 bugs. This is first bug, name bursa hepatica. In bursa hepatica we have right lobe of liver, borders, right abdominal wall, ligamentum falciforme. This is ligamentum falciforme. Above is diaphragm, below is mesentery for transverse colon. Bursa hepatica. Next bursa, bursa pregastrica. What does it mean, pregastrica? So I will show you on the chart. Okay. This is stomach. Yes. In front of stomach is bursa pregastrica. It looks like slit because this is cut, vertical cut. In the body is not slit. So, bursa hepatica, then bursa pregastrica. Pregastrica means in front of stomach. So, what is inside? Inside left lobe of liver, anterior wall of stomach, and spleen. Inside bursa pregastrica, in front of stomach. What is border? Again, diaphragm, then ligamentum falciforme, mesentery of transverse colon, and left abdominal wall. Bursa pregastrica, in front of stomach. And third bug is bursa ommentalis or bursa epiploica. It's behind stomach. How to show? On the body you cannot show, but you can put finger inside this bug because of there is opening leads to this bug. What is the border? Diaphragm, in front stomach, so posterior wall of stomach, and behind is abdominal wall. Part of bursa ommentalis is lesser omentum, omentum minus. What is lesser omentum? There are 3 ligaments form lesser omentum. From liver to the duodenum, ligamentum hepatoduodenale. From liver to the stomach, ligamentum hepatogastricum. And from stomach to the diaphragm, ligamentum phrenica gastricum. 3 ligaments form lesser omentum. Inside, behind lesser omentum, we have opening. How to show this opening? Foramen epiploicum that leads to the back, you should put finger like hook below liver, and you will find it. Ligamentum ommentalia, another name is Winslow foramen, or ligamentum epiploicum. Border of Winslow foramen. Below is duodenum, in front is lesser omentum, 3 ligaments, behind is posterior abdominal wall. Above is caudate lobe of liver. Now, what about lesser omentum? One ligament is ligamentum hepatoduodenale. Inside this ligament we have triad of liver. Remember? And a little trick for you. What is triad of liver? We have duct, vein, and artery. Ductus hepaticus communis, then ductus hyledicus, arteria hepatica propria, and vena porta. In ligament, these structures placed in strict position. At first duct, then vein, then artery, from right to the left. How to remember this? In Hindi, duo, in Latin, dva. DVA, duct, vein, artery. Okay? In this ligament. Okay. So, that was lesser omentum. Now greater omentum. What is greater omentum? This is greater omentum. Greater omentum is duplication of serosa. How is it possible? After liver, serosa go to the stomach and go in front of stomach and behind stomach, and then two sheets on the greater curvature form duplication of serosa. Then duplication of serosa go to the transverse colon and then go down, then turn and go back. So duplication, then one more duplication. So this is duplication of serosa. In one part where is transverse colon, one more visceral sheet of serosa. So in transverse colon there are 5 sheets. So, but usually, what is greater omentum? This is duplication of serosa. 4 sheets of serosa. It hangs freely in front, covers organs. How to show it? You can show it here and on the chart. Duplication of duplication. So, after stomach, 2 visceral sheet turns and go back to the transverse colon and form like apron greater omentum, omentum minus. Now, middle level. About middle level. So, upper level, 3 bucks. Now, middle level. So, what is this? From what starts greater omentum? From transverse colon. What is, so this is colon. What is this? Mesentery. Mesocolon transversum. Okay. So, one more time. What is mesentery? Mesentery is duplication of serosa with vessels inside. Why do we need mesentery? Because of vessels, and mesentery fix organs to the posterior abdominal wall. So this is posterior abdominal wall. Okay. So this is middle level. Yes. On the middle level we have small intestine, ileum and jejunum and ileum. And this is mesentery. This is most important part for middle level. Because of mesentery had this heading from left upper to the right lower corner. And because of this, we have some derivative of serosa, derivative of peritoneum. What derivative? Here we placed like sinus. This is sinus mesentricus dexter. And here we have sinus mesentricus sinister. And there is difference because of sinus mesentricus dexter is closed. Blood cannot go down lower than this level. So bleeding from liver stopped here and looks, because of pain, like appendicitis. But sinus mesentricus sinister is opened to the pelvic cavity, and bleeding from spleen, blood go to the pelvis and looks like pain from organ from pelvis, not like appendicitis. Okay? Next. So sinus mesentricus dexter, sinus mesentricus sinister. Next. Between ascending colon and abdominal wall, and between descending colon and abdominal wall, here we have canal. Canalis abdominalis sinister, canalis abdominalis dexter. Ascending, descending, abdominal wall, canal. Next. When duodenum turns to the jejunum, it makes turn, flexura duodena iunalis. And from this turn to the lateral side, we have little fold. Above and below, we have pits named like pocket. In pocket in Latin, recessus. So we have recessus duodena iunalis superior, and below recessus duodena iunalis inferior. Okay? Next. When we go to when jejunum turns to the cecum, this turn has again 2 pit named pocket. Pocket iliocecalis superior and iliocecalis inferior. there is transition with little fold and two pocket. Now, behind cecum, we have, appendix here. Behind cecum, we have recessus retrocecalis, behind cecum. Next, we go to the transverse column, then to the descending column, and here, on the lower level of descending column, we have sulci paracolici. Then we have lower floor. In the lower floor, transition to the lower floor, we have, what is this? After descending column.
After descending column, the sigmoid.
Sigmoid column.
column.
What is this? Appendices,
Lob,
amentalis or diploices. So
Diploices.
this is sigmoid column. Between turn of sigmoid column, here we have recessus inter sigmoideus. Okay, so one more pocket here. Then lower floor. Lower floor is difference in male and female. And here. So, peritoneum form structure looks like bug, and in men this bug is closed, no connection with external environment. In women, peritoneal bug is have connection with external environment by fallopian tube. And there is difference. In small pelvis, male and female has space in front of bladder, urinary bladder, in front of bladder. This space named spatium prevesicale. Spatium prevesicale. In men, then, we have space between urinary bladder and rectum, spatium rectovesicale, or in Latin and English, rectovesical pouch. But in women, we have uterus between rectum and urinary bladder, and we have two space. So, start name two the uterus. First is spatium vesica uterina, and second is spatium recto uterina. And this space is important because of second name of the Douglas pouch. So, for this space, in this space, blood can accumulate. So usually blood accumulate in this space. When we learn about urogenital system of female, we will learn about this pouch, how to make punctate, okay, to diagnostics. So, men only two spaces, women three spaces, okay, spatium. This is a difference of third lower floor of peritoneum. That's all about peritoneum. Next part. Let's take part in little respiratory system. At first, nasal cavities. You already know most information about nasal cavity. You already know about borders. Below is palate. Above is ethmoid bone and sphenoid bone, form nasal cavity, cavitas nasi. Cavitas nasi has connection with external environment with foramen piriforme, and then goes to the nares, in English, nostrils. So behind connects with the pharynx, with choanus. Nasal cavity has two parts, upper part for smelling, pars olfactoria, lower part for breathing, pars respiratoria. Border is on the middle nasal meatus. Partially middle nasal meatus is olfactory, parts respiratory. Connections of nasal cavity. So there are 6 connections. First is choanus, then foramen piriforme, then canalis incisivus with oral cavity, then canalis nasolacrimalis with orbits. Canalis nasolacrimalis opens to the inferior meatus nasalis, and incisivus the same, inferior. Also with fossa pterygopalatina, foramen sphenopalatинum, upper nasal meatus, and canalis palatinus major with lower nasal meatus. Also, nasal cavity has sinuses from bones. Maxilla, frontal bone, ethmoidal bone, and sphenoidal bone. Sphenoidal sinus and posterior cells of ethmoid sinus opens to the superior nasal meatus. What do you remember? It's very short. So, maxillar, frontal, and anterior and middle cells of ethmoid opens to the middle nasal meatus. External nose. So, yes, septum. In nasal cavity we have septum, most part formed by vomer, also ethmoid bone and maxilla and palatine bone. Septum divided nasal cavity on two parts, right and left. Posterior part is bone part, in front is cartilage part of septum, septum nasi. And external nose consists of cartilages. How many cartilage? We have lateral cartilage, greater and lesser wings cartilage, and parts of external nose: tip, dorsum, back, and lateral part, ala, nares. After nasal cavity, function of nasal cavity. There are three functions: purification, warming, and humidity or moistening. After nasal cavity, we have pharynx. You already know about pharynx. But air should go to the larynx. So it passes to the pharynx and go to the enter to the larynx, additus larynx. What about larynx? You should know. This is larynx. So this is enter to the larynx. Yes, additus larynx. This is epiglottis. When we eat something or drink something, epiglottis go and close additus larynx. So, for larynx, we should know about syncope. So, do you remember syncope of pharynx? So, middle part, oropharynx, at the level corresponds with the third cervical vertebrae. So, larynx starts with the third cervical vertebrae and goes till sixth cervical vertebrae. Very short larynx. Next, what is larynx? Larynx is a cartilage muscle tube organ. How many cartilages? Better in front. So you already know, I think, this cartilage. This is thyroid cartilage. Thyroid cartilage consists of two plates and connection between them. It forms angle superior incisura thyroid superior, incisura thyroid inferior, and horn behind it. Next cartilage. Next cartilage is placed below thyroid cartilage around larynx. And this is ring with plate. This is cricoid cartilage. Cricoid you can translate like a finger ring. Yes, not only a ring with plate, finger ring. So this is ring and plate. This is cricoid cartilage. Next, above, behind and above cricoid cartilage, here we have arytenoid cartilages. So double, yes, paired. Above arytenoid cartilage, we have little carniculate cartilage and little cuneiform cartilage. And one more is epiglottis. It's also cartilages. 6 cartilages. Next, cartilages form base of larynx. What else? Around cartilages we have muscles. What muscles? We have three kind of muscles. Muscles makes narrower contractors, then dilatators makes shorter, and muscle that can change tangent of vocal ligament. What is a vocal ligament? Inside larynx we have two folds, this fold and this fold. You open it and you should show me this fold above, is it? And this fold below. Upper fold is vestibular fold. Lower is vocal fold. So upper vestibular, lower vocal. In vocal fold, with vocal fold, we produce voice. So, what muscle? At first, muscle that can contract larynx. From cricoid to the arytenoid. Musculus cricoarytenoidus lateralis. This. Next. Musculus tyroarytenoidus. This. Cricoarytenoidus lateralis, tyroarytenoidus. Then, behind, between two arytenoid cartilages, we have musculi arytenoidei obliqui, and in this heading, musculus arytenoidus transversus. These are constrictors. Now, dilatators. Constrictors like around. Dilatators in this heading. So, that was lateralis, now this. Musculus cricoarytenoidus posterior. And musculus tyroepiglottis. These two dilatators. And last group is muscle that can change tangent of vocal fold. First, very easy. Inside vocal fold we have musculus vocalis. This muscle contract, so it makes close to each other 2 points. So relax vocal fold. How to make vocal fold strength? If we take part here, point of fixation, and take part here and tangent muscle here, we can make 2 points longer, too far to each other. So musculus cricoarytenoidus, it makes longer 2 parts because of goes around. So 2 muscles that change, one relaxed, one strains. And the parts of cavity. Upper part is vestibulum. Upper part is vestibulum laryngis. Then this part named glottis for voice. Glottis consists of 2 ligaments, vestibular ligament and vocal ligament. And inside vocal ligament, do you remember ligamentum vocale and musculus vocalis? Between ligaments, this and this rima vestibuli, here between vocal and vocal, rimo vocalis. We use only vocalis. And what is between 2 different ligaments? This is ventriculus laryngis or sinus marganii. Lower part named like below glottis, infraglottis, infraglottic cavity. So these are larynx. I said about sclerotopia, forgot about syntopia of larynx. In front of larynx, space, fossa and cervicalis consist of 2 sheets, parietal, visceral, and there is space. Spatium pretracheale, also in front of larynx. With the thyroid gland. Laterally nervovascular bundle, behind is pharynx. Laryngopharynx. Next is, what is then? Next is trachea. So it's already of trachea. What is trachea? This trachea, or you can show here. This is trachea. Here is better because you can see that this part is harder. This is cartilage. And behind is, there are no cartilages. So trachea is hollow tube-shaped organ, consists of 16-20 cartilages. Cartilago tracheidea. Between cartilages, cartilage between them. Like cartilage between them. This is ligament, ligamentum annulare. Ligament is around. Cartilage not around, only 2-third surface.
Ligamentum annulare.
Ligamentum annulare between cartilage, and this is cartilage, and behind is membrane, pars membranaceus, trachea. Syntopia of trachea from 6th cervical vertebra till 5th thoracic vertebra. Then bifurcation of trachea at the level of 5th thoracic vertebra. Syncope, you already know. Behind trachea is esophagus. In front trachea is sternum with thymus. Laterally, neurovascular bundle, vagus nerve, and from right azygos vein. Now, after trachea, we have bifurcation. This is carinotrachea at the lower part of bifurcation. And then we have bronchs. What about bronchs? Bronchs is very easy because bronchs is the same structure as trachea, the same. But you should know about bronchial tree. What is bronchial tree? How bronchs divided? Trachea divided on two. Its name bifurcation. And bronchs divided only on two. Only bifurcation. But we have different lungs. For right, we have two, upper and lower lobe. So bifurcation is correct. What about left is correct? What about right? So difference is so trachea bifurcation. So this is left. Every time when we use patient, it stay face to face, yes? So your right is his left. For left, it's okay. We have bifurcates only. So this part is first stage of bronchial tree. This is main bronch, principal bronch. And this is principal sinister, bronchus principalis sinister, left main bronch. And here we have only two lobe of lungs, bifurcation. So after principal we have lobe, lobar bronch. Superior, inferior, it's okay. What about right side? For right side, we also have bifurcates. Bronchs only bifurcates. But there are three lobes, yes? So how bifurcates? We have upper and then we have stem, short bronch. We not count it in the bronchial tree. After stem, we have bifurcation. Okay? So we have principal, then we have upper lobar, stem, and stem divided on middle and lower. Again, bifurcation. Now, this is first stage, then lobar, then after lobar we have segments. Segmental, subsegmental, interlobular, lobular, terminal. 7 for today. Okay? That's all? Latin pneumo or pulmonis. Lungs is, bless you, paired organ, paired air organ of thoracic cavity. How to set lungs in correct position? Better to understand, this is trachea, in front is cartilage, behind is membranes part. So this is correct position of lungs. So there is difference between right and left. Left has only two lobe, right has upper, middle and lower. So both lungs has oblique fissure, fissura obliqua, both fissura obliqua, and only right has horizontal fissure, separated middle from upper. Every lung has 10 segments, lower 5 segment, for left upper 5 segment, for right middle 2 segment, and upper 3 segments. Now, lungs belong to the walls of thoracic cavity. Because of this, surfaces of lungs named with costal surface, facies costalis, below is diaphragmatic surface, facies diaphragmatica, and this is middle surface, facies medialis, and middle surface has two parts. In front is mediastinal, and behind, close to the vertebral column, vertebralis. In the middle surface, there is a gate. This is base. Above is apex. Apex pulmonis, basis pulmonis, hilum pulmonis. In the hilum, this is the root of lung, radix pulmonis. Root of lungs is different between right and left because of root of lung is bronchs, veins and artery goes to the lung and from the lung. So artery, bronch and vein for right and bronch, artery, vein for left. Now lungs placed in thoracic cavity and covered with pleura. Pleura is serosa. So tunica serosa. Pleura covered not only lungs, it covered also walls. So that part of pleura that covers lungs and fuse with tissue of lungs, this is visceral sheet of pleura. And along wall, this is parietal sheet of pleura. Because there are different walls. We have along to the ribs costal pleura, diaphragmatic pleura, and middle part we have mediastinal pleura. And there is difference between visceral and parietal. We have space. This is pleural space, cavum pleurale. Inside this space we have about 2 milliliters of serous fluid to reduce friction. So what is cavum pleurale, pleural space? This is space between visceral and parietal sheet. But parietal sheet goes further than lung and form sinus. Sinus is space between two parietal sheets. So visceral stop here and two parietal goes further. So this is costal, this is diaphragmatic. So there are 4 different sinuses. What is sinuses? Sinuses or recessus pockets. This is space between two parietal sheets. And we have from costal to diaphragmatic, costal diaphragmatic. Between diaphragmatic, diaphragmatic and mediastinal we have mediastinal diaphragmatic. Diaphragmatic and mediastinal. Between costal and mediastinal we have costa mediastinal, and behind, because of vertebral column, we have between vertebral column and mediastinum 4 sinuses. Because of 3 and 2 lobes, there is difference, because on the left lung we have this notch for heart, cardiac, incisura cardiaca pulmonis, sinistra. We don't have dextra, only sinistra. And lower part named like little tongue, lingula pneumonis sinistra. And we have only sinistra, no dextra. Now, what is between lungs? Between lungs we have mediastinum. What is mediastinum? Mediastinum is complex of organ between lungs covered with mediastinal pleura. If we make a plane, imaginary plane, goes along root of lung, or along anterior wall of esophagus, or along posterior wall of trachea, we divided mediastinum on 2 parts, anterior and posterior. In anterior mediastinum, we have trachea, heart with pericard, ascending aorta, aortic arch, and root of lung. In the posterior mediastinum, we have esophagus, descending aorta, thoracic duct, azygos vein, hemiazygos vein, 2 vagus nerve, and lymphatic nodes. Now borders. It means skeletopy of lungs and pleura. Can I use your body, please? Thank you. So, projection of lungs on the costal system, on the skeleton. So, at first is lower border of lungs. Start with 6 rib along linea medioclavicularis. Rule. Next line plus 1 rib. So first point is linea medioclavicularis 6 rib. Then linea axillaris anterior 7 rib. Then linea axillaris media 8 rib. Then linea axillaris posterior 9 rib. Linea scapularis 10 rib, and linea vertebralis 11 rib. So this is lower border. What about posterior border? From 11 along linea vertebralis. Where is upper border? Upper border above 2 or 3 centimeters above clavicle. What about anterior border? For right lung, anterior border start from 2 centimeters above clavicle, goes to the sternoclavicular joint, then along linea sternalis till 6th rib. Then along 6th rib, the linea medioclavicularis. This is beginning of inferior border. For left lung, we have different 2 or 3 centimeters above clavicle, then sternoclavicular joint, then along linea sternalis till 4 rib, not 6. 4 rib to the linea parasternalis, then down till 6 rib, and now 6 rib to the linea medioclavicularis. Okay, so there is difference because of heart. Incisura cardiaca is here. What about borders of pleura? So, inferior border, the same but plus 1 rib. So, start from linea medioclavicularis, but 7th rib. Then goes to the posterior. So, plus 1 rib, so end linea vertebralis, 12th rib. Posterior border, the same with lungs. Thank you. Upper border, the same with lungs. What about anterior border? Anterior border, from upper border till sternoclavicular joint, linea sternalis till 7th rib. For right. What about left? The same but symmetrically. So there are no cardiac notch because of pleura in front of heart. That's all. Now you should understand. If you need punctate lung, or better not lung, it means punctate pleural cavity. So you should understand where is the point that you can punctate. You cannot go above and punctate lung, and you cannot go down because of it's not pleural cavity. So, and where is the difference? For example, linea scapularis. Yes. So, for example, linea scapularis. Where is border of lung? This is 10 rib.
10.
Border of pleura, 11 rib. So, between 10, 11 rib, linea scapularis. And where should you punctate? We have rib, and where this is space. Above, close to the 10 rib, or below, close to the 11 rib. 11. Why? Because of vessel and nerves on the groove of the rib, on the lower edge of rib. Okay? Good. Anatomy. That's all. So next class on Saturday we will learn about heart. After heart, next Wednesday we will have final viva about digestive system,
Respiratory system.
and heart. Yes. Can you? What is this?
Right lobe,
Stem.
stem.
Yes. This
Upper
upper right lobe. This
left
Principal
bronchus.
Principal.
principal. What is this?
Carina.
What is this?
Cartilage or trachea.
Cartilage. 2 by 3.
What is this?
Lingual.
Okay. How many segments in right lung?
3.
In right lung.
Right lung.
Segments.
Segments.
Lateral 10 segments, so below 5
Okay.
segments.
Every lung. Do you see thickness of wall? About 1 centimeter and 2 milliliters here. And here is not so big, yes? So this is thinner. This is fatter. So this is left ventricle. Why left ventricle is bigger? Because left ventricle give blood to the whole body. For legs, for arms, for head, for body. Right ventricle only for lungs. So smaller. So bigger part, smaller part. So place heart in your left hand and you will see this is correct position of heart. So heart is unpaired hollow organ placed in thoracic cavity, covered with serota. but not inside pleural cavity. Okay, it has a cavity for only heart, pericardial cavity. So this is apex of heart. Heart in Latin cor, cordis, apex cordis. This is base of heart, basis cordis. And we have axis of heart. Axis heading is below, to the left and in front. Now we have anterior surface and lower surface, but because lower surface close to the diaphragm is diaphragmatic surface also. In front of heart we have sternum, below we have diaphragm, behind we have descending aorta and thoracic duct, above large vessels. Heart placed in anterior mediastinum, so by the sides is lungs. Now chambers of heart. So there are 4 chambers of heart: right atrium, left atrium, right ventricle, left ventricle. How to understand this is atrium or not? So almost all part of heart is ventricles, 2 ventricles. Lesser part is atrium, and atrium placed behind 2 main vessels. So this is atrium. You can see this is septum between 2 atrium, this and here, septum. So this is right atrium, this is left atrium. Let's start with the right atrium. So right atrium, atrium dexter. Collect blood from all body. So we have vena cava superior and vena cava inferior. Also one more vein is sinus coronarius, goes and placed very close to the vena cava inferior. So vena cava superior, vena cava inferior, sinus coronarius here. Right atrium.
Which one is sinus?
Yes, it's stored, but it should be here. Sinus coronarius here, because of this is a groove. Yes, about grooves. So between right and left here is groove. Sulcus anterior. Behind is sulcus posterior. On the apex to groove unite and form notch. Incisura cordis. Apices. Incisura apices cordis. So vena cava superior, vena cava inferior to the atrium. On the atrium we have this little part looks in front like little ear, auricula dextra. Inside heart surface is smooth. In auricula we have little muscles, pectineal muscles. So here is not smooth surface because of muscles. Between 2 atrium here we have septum, interatrial septum. And in interatrial septum here we have a little pit, fossa ovalis. Before childbirth we have opening. Now it overgrown, so there is no opening in normal state. There is only pit, fossa ovalis. What is after right atrium? After right atrium we have right ventricle. So atrium leads to the ventricle, and space between atrium and ventricle, it's here, third, is atrioventricular ostium. Ostium atrioventricular, no space, foramen. Ostium atrioventriculare sinistrum. There is valve. Valva atrioventriculare sinistrum. Sorry, dextra. Valva atrioventriculare dextra. Or tricuspid valve. Tricuspid because of 3 parts form this valve. Parts, old name is cusps. New English name is laflets. But Latin still cusp. So we have 3 cusp that form valve. To the cusp we have tendon attached to the cusp. This is horda tendinea. Horda tendinea leads to the ventricle, and in the end there is muscle. In the auricula there is pectinate muscle. In the ventricle this is papillary muscle. We have 3 cusps So we have 3 tendon, we have 3 papillary muscles. Also in the end of ventricle. In the end of ventricle. So it's stored here. So this is cusp. It's not left, it's not right, it's left, but its structure is the same. So it's cusp, start with tendon like this and leads to the papillary muscle like this. And in the end of ventricle, this structure is a fleshy crossbar, trabeculae cornea. So this is inside ventricle. Now we into the right ventricle. What is after? After right ventricle, blood should go to the lungs. So after right ventricle, we have truncus pulmonalis, pulmonary trunk. So this opening, ostium pulmonari or ostium trunci pulmonari, and inside is valve, valvula pulmonaris. Valvula pulmonaris has 3 parts, and this is not cusps. This is vulvula, like little valve. Vulvula has different structure. In the middle, it has nodus, and after nodus we have structure named lunula. This is for better closing. So this is pulmonary trunk in front. So you can see 3 vulvula. This, and this. 3 vulvula. Do you see inside 3 parts? Yes. Okay. 3 parts inside. 3 parts inside. Yes? Okay. So after pulmonary trunk, pulmonary, and you should remember, after ventricles we have only arteries. So pulmonary trunk, it's like artery. So after heart we have only arteries. Okay, to the heart only veins. Now left side. Left side start with left atrium, atrium sinister, and also we have auricula sinistra. Looks in front again. Sinistra, dextra. Left atrium collect blood after lungs. So 4 pulmonary veins flows to the left atrium. And left atrium, smooth surface and inside pectinate muscles. Leads to the left ventricle. So here we have left ventricle. Left atrium to the left ventricle. So this opening is ostium atrioventriculare sinistra. And there is bicuspid valve, 2 parts, 2 cusps. After cusps, we also have chorda tendinea, then muscle, papillary muscles. So 2 cusps, 2 chordae, 2 papillary muscles, only anterior and posterior. What is after right ventricle? After right ventricle, we should give blood to the all parts of body. So then start aorta. Aorta. So this is opening of aorta. Do you see? Opening of aorta. So ostium aortae and this valve, valva aortae, consists of 3 parts. Again, this is vulvula with knot in the center and lunula to the walls. So, external wall structure of heart. What covers? Heart has 3 walls. First is pericard, then myocard, then endocard. So you can say like tunica serosa around, then tunica muscularis in the middle, and tunica mucosa inside. But because of heart, pericard, myocard, endocard. So what is pericard? Pericard consists of 3 sub-layers. First is fibrous pericard, around. It fused with tunica adventitia around. Then, after fibrous pericard, inside, close to the internal surface, we have tunica serosa. Pericard is the same like tunica serosa, but pericard also has separated parietal sheet named tunica serosa. So tunica serosa is parietal sheet of pericard. It's around heart. Then we have visceral sheet that covers heart, and between them we have space. So here you can see only visceral sheet of pericard, tunica serosa. So between this space, it's pericardial space, where is heart. What is after pericard? After pericard we have tunica muscularis, myocard. And myocard don't have point of beginning and point of attachment. Heart not attached to anything except outside. So, but because between atrium and ventricle we have openings, and around openings we have fibrous rings that form like skeleton of heart. So muscles attach to these rings around openings, and this is point of beginning and point of attachment for muscle tunic. So pericard of heart different between atrium and ventricle. On the atrium we have two layers. Circular outer common for atrium, and longitudinal. Longitudinal separate for right and left. And for ventricles we have outer longitudinal common, then circular separates left and right, and inner is again longitudinal, again common. And outer longitudinal goes inside to the inner longitudinal and form turn, here named vertex. And inside cavity of heart covered with tunica mucosa named endocard. And derivative of endocard is all valves. Now conductive system of heart. On to the right atrium, on the wall of right atrium, we have first level. This is sinoatrial node, this flag. This is beginning of conductive system, gives impulse, gives start. And heartbeat about 60 till 90 in normal state, in the rest, when rest. Then again in the wall of right atrium we have atrioventricular node. So name is atrioventricular but placed in atrium. So this is a Shoftavar node. Between these two nodes we have bank one and wing one, two legs. After sinoatrial node goes to the septum between two ventricles, and there is fibers of Purkinje. So leg named Gis, then fibers of Purkinje. Okay, so three nodes, two in atrium, one in septum. Why do we need this? If one node is not work, another node gives function, but next node gives us lesser heartbeat, so heart works slowly, like slowly. What about interventricular septum? Anterior part if is membrane, posterior to third is muscle part. Next is blood supplying of heart and borders. What about skeletopy of heart, borders of heart? So this is apex. Apex is placed 1 centimeter medially from linea medioclavicularis sinistra at the level of fifth intercostal space, or you can say fifth rib. Now we have right border. This is linea parasternalis dextra. From second, or you can say second intercostal space, or you can say upper border of third rib till the fifth rib. Lower border along fifth rib. Right border, left border along linea parasternalis sinistra, from second to the fifth, and upper border at the level of second intercostal space, or you can say upper level of third rib. Border. Syncope already. And in this topic we also should learn about blood supplying of heart. What does it mean, blood supplying to heart? Blood supplying means blood to the heart and blood out of heart. Heart gives blood to our body, but this is not blood supplying of heart. This is function of heart. What is blood supplying of heart? On the aorta, after aorta start from left ventricle, we have two arteries, arteria coronaria sinistra and arteria coronaria dextra. Dextra goes around heart and lies in this sinus, sinus coronarius, and dextra goes to the sulcus interventricularis posterior. Left artery goes to the left side and gives two branches. One branch lies in front to the sulcus interventricularis anterior, and you need connection with the posterior. Another branch goes back, circumflexa, arteria circumflexa, and you need again with dextra, both behind. So we have circle here and we have circle here. So if one artery doesn't work properly, another artery can take this function. Okay. And you should know what parts of heart blood supplying from right and from left. So at first, right coronary artery. It blood supplying right atrium, interatrial septum, partially anterior wall of right ventricle, whole posterior wall of right ventricle, a little part of posterior wall of left ventricle, all papillary muscle in right ventricle, posterior papillary muscle in left ventricle, and posterior third of interventricular septum. What about left coronary artery? Left coronary artery, blood supplying a little part of almost all, so most of part, anterior wall of right ventricle, almost all left ventricle except a little part on the posterior wall, left atrium, and anterior two-thirds of interventricular septum. So damage of left artery is more dangerous because of left ventricle for all heart. Okay. It's not only blood to the heart, it's also blood from the heart. What about blood from the heart? So this is venous outflow or blood outflow from heart. There are three ways. First way is this vein. Its name sinus coronarius. It flows to the right atrium. Sinus coronarius has inflows. What inflows? Vena magna, vena parva, vena minima, and vena media, and vein for separatedly for left ventricle, vena ventriculi sinistri posterior, and for left atrium, vena atrii sinistri obliqua. So 5 sources for sinus coronarius. Next source. On the anterior wall of right ventricle we have vena anterioris cordis. It flows to the right atrium and to the right ventricle. And third way is vena minimi cordis or Tibesian veins. This vein placed inside wall, inside thickness, and flows to the atrium, and most of flows to the right ventricle immediately itself. So 3 ways for veins, 3 ways for venous outflow of heart. That's all. Okay. So next class is final viva. It will be on Wednesday.